The title of my lesson is Congestive Heart Failure. In this lesson, I'm hoping to meet the following learning objectives. That at the end of the lesson, the students will be able to understand the signs and symptoms of CHF and factors leading to exacerbation, demonstrate history-taking skills of possible risk factors of CHF, and recognize the importance of treatment and lifestyle of CHF, lifestyle medication to patients with CHF. My learning goal in here includes to increase student awareness and understanding of CHF disease process to enhance patient education, and my audience are student nurses and professional nurses. I'm going to discuss my discussion using this following diagram. Then I'm going to go one by one at the end, during the course of our lesson. At first, I'm going to start with congestive heart failure facts, which is just like it occurs when the heart is unable to pump sufficient amount of blood to meet the body needs. And why these things happen? Because of the clogging of arteries and the narrowing of arteries. Then we will ask why there is a clogging and narrowing of arteries. Clogging and narrowing of arteries are caused by some CHF factors like elderly, female, ethnic African American, smoking, alcohol, obesity, and some medical condition. And the medical condition that cause clogging of the artery includes diabetes, coronary artery disease, and atherosclerosis, and the one that narrowed arteries is chronic hypertension. The narrowing and clogging of arteries causes decreased blood supply to the heart, which eventually leading to myocardial cells injury. And once the myocardial cells injured, decrease its function by decreasing stroke volume that eventually affect the body system by decreasing cardiac output. Then the body will gonna start to compensate for this problem by stimulating the sympathetic nervous system. And how the sympathetic nervous system works? By three ways: cardiac remodeling, cardiac function, and renal function. In cardiac remodeling, we will gonna show in here structural changes that occurs in the heart. See the size and shape of the healthy and see the size and shape of a congested heart. So in cardiac remodeling, dilated cardiomyopathy occur when the heart wall enlarge and thinner, and in hypertrophic, heart wall becomes stiff, thicker, and harder, and both of these conditions decrease heart pumping action, leading to fluid overload and congestion. The next compensatory mechanism is the work of the cardiac function by increasing the heart rate. It works for a while because it increases cardiac output, but it won't last for long because eventually it will start to decrease the filling time, and then decreased filling time can cause decreased cardiac output, and the whole outcome also is fluid overload congestion. The third compensatory mechanism is improving by renal function. And what will happen in the renal function is start to release some hormones like renin, angiotensin, and aldosterone. And aldosterone, we know, aldosterone can cause increased sodium and water retention in the body. All of this causing to fluid overload and congestion, leading to the signs and symptoms of CHF. If left-sided heart failure is a car, it can cause pulmonary edema because of the backward flow of blood in the lungs, leading to signs and symptoms of shortness of breath and crackles. And if the right-sided heart failure occur, the backward flow of blood to the systemic system, leading to peripheral edema as manifested by JVD, or jugular venous distension, leg swelling, abdominal enlargement. But all these things still can be treated and improve patient care. And how we will gonna do this? By the goal of management is to increase cardiac function, improve pumping ability, and reduce the workload of the heart. And how we will do that? Some pharmacological management will gonna help taking care of this CHF problem. Angiotensin converting enzyme, it's acts as a vasodilator that open the narrowed arteries. ARB are the substitute for ACE. Beta blocker strengthen the force of contraction to the heart. Loop diuretics of leg 6 decrease workload in the heart. And aldosterone is the potassium sparing diuretics. Inotropes, milrinone, it increase contractility of the heart. Some pharmacological management that will gonna improve the patient's condition with CHF are exercise, activities encouraged but limited during exacerbation, diet, sodium restricted to 2 to 3 grams per day, fluid restriction to 1 liter, and nutrition, avoid processed and canned food. Surgical management include AICD, CABG, stent placement, valve replacement, and ventricular assistive device. Some patient education we will gonna include in here: daily weight gain monitoring, report 3 to 5 pounds weight gain, activity, start with 30 minutes to 150 per week, discharge medication, compliance to medication and treatment, and new medicine, dosing, frequency, side effects and complication, and diet as we mentioned, and if the worsened symptoms occur, follow up with a primary ND and consider some 911 emergency. Some facts include CHF facts before we end are 5.9 million in US have heart failure. 1 in 9 death in 2000, heart failure is the cause, and about half of people who develop heart failure die within 5 years of diagnosis if not taken care of very well, and the cost is 30.7 billion each year. Thank you for watching this video.